Welcome, ladies and gentlemen, to sqadia.com. My name is Mohammad Osama, and we are talking about nutritional disorders and specifically water soluble vitamins when it comes to nutritional disorders. So, in this lecture, we are going to talk about the types of vitamins, the water soluble vitamins, and the dietary sources for those water soluble vitamins. So, let's start off what vitamins are. So, a vitamin is actually an organic compound which is actually an essential nutrient. It may not give energy or calories to an individual, but they are essential and they are required in limited amounts for the normal functioning of the physiological processes in a human body. So they do not or they may not have caloric you can say caloric need with them, but they are still essential for different type of physiological processes. And there are two major types of vitamins, which is the water soluble vitamins and fat soluble vitamins. So as the name suggests, water soluble vitamins, they are soluble in water, and as water cannot be stored, so these vitamins cannot be stored in the body, so they need to be taken up in the diet regularly because they cannot be stored. So they are very essential in that sense. On the other hand, fat soluble vitamins are soluble in fats and adipose tissue, and for these type of vitamins, the fat absorption in the gut or in the gastrointestinal tract is very important, first of all. And secondly, the good thing about these vitamins are that as they are fat soluble, so they can be stored in the human body, and even if the diet is deficient of those fat soluble vitamins, those vitamins can be taken up from those storehouses in the body and utilized. So that is a good thing about those fat soluble vitamins. But that is not possible with those water soluble vitamins. One more thing important is that the poisoning related to vitamin or hypervitaminosis is not common with water soluble vitamins because they cannot be stored and they are passed on with the urine. On the other hand, fat soluble vitamins, if they are taken in excessive amount, can result in hypervitaminosis, which is also a nutritional disorder. So that is one of the negative aspects of those fat soluble vitamins. Now, water soluble vitamins, as we already discussed, they cannot be stored in the body. So the regular intake of these vitamins is very essential, except for vitamin B12, because vitamin B12 can be stored in high quantities in liver. Thus, a deprivation of even months or even years is required to cause a depletion of vitamin B12. But all other water-soluble vitamins, they need to be taken in diet very much regularly to avoid any case of malnutrition or vitamin deficiency. And water-soluble vitamins, as I already said or discussed, that they rarely result in vitamin toxicity or hypervitaminosis because these vitamins are secreted in urine and they cannot be stored in the body. Now, what are the different types of vitamins? So, water-soluble vitamins consist of beta complex vitamins such as B1, vitamin B1, also known as thiamine, vitamin B2, riboflavin, vitamin B3, niacin, vitamin B6, pyridoxine, vitamin B12, cobalamin, and folic acid, and vitamin C, which is also known as ascorbic acid. So if you just look at the summary of these water soluble vitamins, so vitamin B1, which is also known as thiamine, it is essential for normal growth and carbohydrate metabolism, and deficiency of which can result in beriberi and Wernicke-Korsakoff disease. On the other hand, vitamin B2, also known as riboflavin, it is actually a coenzyme in protein and energy metabolism, and its sources are dairy products like milk and also liver. Vitamin B3, which is known as niacin, is essential for normal growth, and its deficiency may result in pellagra, which we will look into detail in the diseases associated with vitamin deficiency. Vitamin B6, which is also known as pyridoxine, it is very important in amino acid metabolism, and its deficiency can result in peripheral neuropathy. Folic acid is very important in red blood cell or erythrocyte formation, and its deficiency can result in spinal bifida or neural tube defects as well as because it's involved in RBC formation. So a disruption can that also result in problems associated with erythrocytes and red blood cells. And the vitamin B12, which is the cyanocobalamin, its deficiency can lead to pernicious anemia, nerve function, and RBCs related deficits. And vitamin C and folic acid, we're also going to look in detail. Vitamin C is also very commonly found in citrus fruit, and it is also known as ascorbic acid. So if we talk about the dietary sources of different type of vitamins, so vitamin C, as I already said, citrus fruits like oranges and bell peppers, guavas, dark and leafy green vegetables are also a good source, kiwi, broccoli, and strawberries. Talking about vitamin B12, the good sources for that is meat, fish, poultry, eggs, and dairy products like milk and cheese and butter, etc. Vitamin B9, which is also known as folate or folic acid, the sources for it include beans, lentils, spinach, which is a green leafy vegetable, asparagus, lettuce, avocado, broccoli, tropical fruits like mango and oranges. Vitamin B3, which is also known as niacin, it includes the sources includes lean meat without fat and adipose tissue, poultry, fish, organ meats, peanuts, and peanut butter. And vitamin B6, also known as pyridoxine, the sources for that include poultry, fish, soybeans, nuts, peas, and bananas. Now, deficiencies, generally talking about the deficiencies of water-soluble vitamins, they are actually a shared group of clinical manifestations. There may be common manifestations in different type of vitamin deficiencies. And if we talk about the vitamin B complex, so it is often marked with glossitis, inflammation of the dermis of the skin, also known as dermatitis, and diarrhea. So this is actually a triad of the manifestation which is common to all type of vitamin B complex deficiencies. And water-soluble vitamin deficiencies are manifested clinically most strikingly in tissues that are metabolically active, because these vitamins are involved in release and storage of energy and different type of metabolic processes. So their deficiencies affect those tissues which are metabolically most, metabolically most active. So that was all about the introduction to the water-soluble vitamins. We are going to talk in detail regarding the deficiencies of the water-soluble vitamins in the next lecture. So please stay tuned for that lecture. And thank you very much for watching sqadia.com.